The situation is pretty bad. Enough is what the Chief Minister Amarinder Singh has said. A weekend lockdown has been imposed, a daily night curfew from 7 p.m. to 5 a.m. in all cities and towns, a total ban on all gatherings except weddings and funerals, buses and transport vehicles to ply at 50%. Joining us now, DK Tiwari, the Principal Secretary of Medical Education and Research. Mr. Tiwari, there's been a sero survey which has been done in containment zones in Punjab as well. In some areas, it's been as high as 40%. Does this not indicate that at some level, whether it's the government or people or whatever it is, there's been a failure, that you're not able to bring it down at the speed at which you want?
Let me explain it. Actually, this sero surveillance which has been conducted in 5 major towns, this has been conducted only in the containment zones, number one. Number two, the sample size we have taken only 240. So on the basis of this initial sero surveillance which we have started, the figures are there that out of this sample size of 240, we have 19% in Patiala, we have SAS Nagar 33%, we have Jalandhar 10.8%, we have Ludhiana 35%, and Amritsar 40%. But this is to the extent in very, very limited areas which were already declared containment zones, and the data has been taken only from these areas. So we can't say that this reflects the entire city.
And as far as the numbers overnight, the very significant numbers happening now, and the Chief Minister announcing a series of steps, what does this reflect? Does it reflect that there is widespread prevalence now, that the situation, that it continues to spread, and that the R rate is nowhere in terms of coming down to below 1, by which time you can say that, look, we are winning this?
Yeah, I would like to inform you that we have done sampling of around 8,19,000 in Punjab. And out of that, 36,000 are positive, which comes around 4.4%. So as on date, if we say that 4.4% out of the sample size is coming, that is still within the control limits. And but thinking that our doubling rate will be around 15 to 16 days. So how to control this doubling rate and to control the situation at this stage where it should be contained as far as our health facilities which are available in government sector as well as in the private sector.
Yes.
Honorable CM has announced certain measures.
Yes, I mean, fairly extensive measures. Only 50% non-essential shops, for example, will be open daily in 5 worst affected districts. He's ordered ramping up of tests of 10 contacts of all COVID positive patients and many more. I'd like to thank you, Mr. Tiwari. I'm out of time over here. DK Tiwari, Principal Secretary, Medical Education and Research. And just as I end this, I'd just like to highlight a few other points announced by the Punjab Chief Minister. He's directed Health Department to provide free ventilators and manpower support to private hospitals as well.